Chloramphenicol is a broad-spectrum antibiotic that is active against both gram-positive and gram-negative bacteria. However, due to its severe toxicity, chloramphenicol is no longer used as the first medication of choice in most countries with access to safer antibiotics. Instead, this medication is typically used when other antibiotics are ineffective or contraindicated. Nowadays, chloramphenicol is most often used intravenously, and since it readily crosses the blood-brain barrier, it may be used to treat bacterial meningitis in clients who have major hypersensitivity reactions to penicillin. Additionally, it can be considered for the treatment of serious rickettsial infections, such as typhus and Rocky Mountain spotted fever. Once administered, chloramphenicol has a bacteriostatic effect by reversibly binding to the 50S subunit of the bacterial ribosome, thereby inhibiting bacterial protein synthesis and ultimately stopping bacterial growth. Now, chloramphenicol may cause side effects like gastrointestinal disturbances, such as nausea, vomiting, and diarrhea. Additionally, it has a box warning for blood dyscrasia, including fatal aplastic anemia, hypoplastic anemia, and bone marrow suppression, and it can increase the risk of developing superinfections. Other side effects of chloramphenicol include severe metabolic acidosis, as well as neurotoxicity, which can manifest as optic neuritis or peripheral neuropathy. Finally, infants lack a hepatic enzyme involved in the metabolism of chloramphenicol, so the medication may accumulate in their body until it reaches toxic levels. As a result, administering chloramphenicol to infants can lead to Gray syndrome, which presents with anemia and cyanosis. In severe cases, there may also be vomiting, hypothermia, limp body, cardiovascular collapse, and eventually death if not treated promptly.
Enjoying our Osmosis videos? Unlock your full potential with an Osmosis subscription. Get unlimited access to every Osmosis feature and resource with a free 7-day trial.
Now, as far as contraindications go, chloramphenicol is not recommended for use during pregnancy, breastfeeding, or in newborns. In addition, chloramphenicol should be used with caution in clients with glucose 6-phosphate dehydrogenase, or G6PD deficiency, as well as in clients with acute porphyria, since this medication could increase the risk of developing an acute porphyria attack. Regarding interactions, chloramphenicol is also a weak inhibitor of the hepatic enzymes in the cytochrome P450 family, so it can interfere with the metabolism of certain medications, including warfarin, sulfonylureas, and phenytoin, which may reach toxic levels. In addition, chloramphenicol can decrease the effect of ceftazidime, estriol, and vitamin B12. Okay, when caring for a client prescribed intravenous chloramphenicol for bacterial meningitis, start by performing a baseline assessment including vital signs and current symptoms like headaches, stiff neck, confusion, and light sensitivity. Then, review recent laboratory test results such as renal and liver function, CBC, blood cultures, and diagnostic results including cerebrospinal fluid analysis. Lastly, confirm the prescribed dose by calculating the medication in milligrams per kilogram per day. Now, let's move on to client education. Explain to your client that the medication will treat the infection causing their symptoms, and that the medication will be administered intravenously every 6 hours. Then, review with them some common side effects they may experience, such as nausea, vomiting, and diarrhea, and reassure them that you will be monitoring them over the course of treatment. Next, when administering chloramphenicol, ensure your client has a patent IV in place. While infusing the medication, monitor their CBC, serum drug concentrations, and the insertion site for a local reaction. In addition, monitor them for signs of neurotoxicity, and ask them to let you know if they feel any numbness or tingling in their hands or feet or visual changes. Watch for the development of a superinfection, which could manifest as abdominal pain and severe or bloody diarrhea, and for bone marrow suppression, which can manifest with fatigue, fever, rash, chills, or a sore throat. Also monitor for bleeding problems, which could manifest as bleeding gums, nosebleeds, or bleeding from the IV insertion site, as well as dark, tarry stools, coughing up blood, or emesis that looks like coffee ground. Also during treatment, administer the prescribed vitamin B12 supplement. Finally, during treatment with chloramphenicol, closely monitor your client's CBC and serum drug concentration levels, and keep an eye out for the development of side effects. Be sure to evaluate for the therapeutic effect of infection resolution and an absence of symptoms. Alright, as a quick recap, chloramphenicol is a broad-spectrum antibiotic that is active against both gram-positive and gram-negative bacteria. However, due to its severe toxicity, chloramphenicol is no longer used as the first medication of choice. Instead, this medication is typically used when other antibiotics are ineffective or contraindicated. Side effects include gastrointestinal disturbances such as nausea, vomiting, and diarrhea, neurotoxicity, and it has a boxed warning for blood dyscrasias, including fatal aplastic anemia, hypoplastic anemia, and bone marrow suppression. When caring for a client receiving chloramphenicol, nursing considerations include performing a baseline assessment, monitoring for side effects, and evaluating for the therapeutic response. Client education is focused on what clients can expect during treatment.
Helping current and future clinicians focus, learn, retain, and thrive. Learn more